Hi, my name is Kathryn Sabo. I'm a second-year PhD student. I would like to share with you my theory of nurse-facilitated health promotion. Some of the background related to my theory is that Americans are living longer. So there's also significant growth in the older adult population. 2014 found that we had 46.3 million Americans who are 65 years or older, and that number is projected to reach 98 million by. As one ages, the likelihood of acquiring a chronic illness increases. And this is significant as chronic illnesses are the leading causes of. Approximately 80% of older adults have at least one chronic illness. Chronic conditions can lower quality of life for older adults. Fortunately, health promotion activities focused on prevention can mitigate this phenomenon. However, because older adults are vulnerable due to chronic illness, multiple morbidity, mental health difficulties, and functional impairment, they require healthcare professionals to facilitate their engagement in these activities. The purpose of my work was to provide a theoretical framework for health promotion that includes the role of the nurse as collaborator and facilitator in older adults with chronic illness. Some of the definitions that frame my model are health promotion, defined as a process of enabling people to increase control over and to improve their health. Chronic illness, which is a or more, requiring ongoing medical attention or limit activities of daily living, or a combination of both. Facilitation is helping clients or patients identify, mobilize, and develop personal strengths in moving towards health. Affiliated individuation is defined as all people have an instinctual drive to be accepted and dependent on support systems throughout life, while also maintaining sense of independence and freedom. Methods used in developing this theory was a review of the empirical and theoretical literature on health promotion and chronic illness in the context of older adults, and then selecting two theories that were relative to this phenomenon, appraising for conceptual congruency and synthesizing them into a conceptual model of health promotion for the older adult with chronic illness that also includes the contribution of the nurse. Theories selected for my theory were Pender's health promotion model that focused on individuals' unique personal characteristics and experience affecting subsequent action, personal, cognitive, and environmental factors providing a motivation for engaging in behaviors, the interpersonal environment that's created by healthcare providers and assists individuals to shape a positive perspective on a targeted health behavior throughout their lifespan. One of the weaknesses of the health promotion model is that it doesn't explicate how nurses assist individuals in health behavior change. The second theory selected was the modeling role modeling theory by Erickson, Tomlin, and Swain. Modeling is the process by which the nurse comes to know and understand the client's world from their perspective. Role modeling is the process by which the nurse facilitates and nurtures the individual in health promotion, accepting the client's unique perspective. The client is viewed as an expert in their holistic health and resource needs. In addition, the role modeling portion of the theory, the nurse is viewed as nurturing biophysical, psychological, social, and spiritual beings. And again, during this phase of modeling and role modeling, the nurse is going to integrate the assessment findings into an individualized intervention that will foster positive outcomes. So the result of my work was a theory synthesis that addresses both the complexity involved in motivating and engaging individuals in health behaviors. And the health promotion model remained intact as a predominant component of the model, with the concepts of modeling and role modeling from the modeling and role modeling theory integrated in. The two-step process of the modeling role modeling theory explicates the role of the nurse in promoting positive health behaviors, and the collaborative relationship between the patient and the nurse results in the engagement of health behavior of individuals with chronic illness. So here is my model with the blue box representing an older adult with chronic illness, the individual, with the white boxes representing the different contributing factors. Those on the outside are those that are external to the person. Those on the inside are internal. The red circles represent the nurse. And then you have the double arrows that represent the collaboration between the patient and the nurse that work together to get to an individualized plan of action, which is, if accepted and feasible, moves on to the health promotion behavior. If it's not, then there's a feedback loop back to the patient where characteristics and their perspective are re-examined between the nurse and the patient, and they collaborate on a revised individualized action plan. I created an exemplar using Mr. P as a 78-year-old Latino male. Listed below on the bullet points are, his past medical history, some of the socio-economic factors, as well as the support system listed below. This slide just goes over what a chief complaint is, for him. So the, history of present illness listed here. And then in applying the theory of nurse-facilitated health promotion, the nurse performs a comprehensive assessment. The bullet points listed below list what holistic findings she garnered during the assessment. And then that assessment is integrated and applied to create an individualized intervention that is holistic in nature. So looking in this case and providing nutritional education that works with the chronic illness, the financial needs of Mr. P, personal preferences of Mr. P. So it's comprehensive and holistic and tailored to meet those unique needs. Resources for at home, and also intervention that's not only driven by a health condition, but a socialization and environmental factors as well. I've provided my references listed below on the next two slides. And I've provided contact information for myself, Kathryn Sabo, as well as my co-author, Elizabeth Chin. We would welcome questions, further discussion, feedback, and can be reached at the emails listed below. I want to thank you for taking the time to hearing about my work. Thank you.